think we're experiencing one of the most difficult times in our lifetime, and we are also obviously coming to terms with the new normal as well. And as medical professionals, we are all the time trying to innovate ourselves, and this time has provided us an opportunity to reflect upon ourselves and upon our skills and the way we manage patients. As Dr. Ashok Seth has said, that the touch and the feel of what we normally are taught, the principles of medicine, the art and science of medicine and surgery, is to be able to communicate with the patient, to examine the patient, because in history and examination, one can obtain a diagnosis in more than 90% of the time. Now we are more than ever reliant on telecommunication, communication online, and then arranging for tests and again speaking to the patient. So that connect is going away. But I think we have to reinvent ourselves, and I think we have to give much credit to our country, which has been able to recognize our Prime Minister's foresight, and he has been able to recognize the difficulty, the crisis, and the timely, effective, and robust lockdown has in many ways significantly helped to flatten the curve and prevent the transmission of the disease. So what we now have to come to terms with is post-lockdown, 5 weeks down the line, we have to certainly remove the stigma associated with this illness. There's a lot of stigma associated with this illness. Stigma is actually resulting in two things. One is it is preventing patients from presenting themselves early. So they're waiting and they're presenting themselves late when they're quite critically ill. The other thing is the stigma and the paranoia associated with this is resulting in a lot of violence as well. As you've seen, recently, as recent as a week ago, a doctor, when he was taken to the burial ground, he was associated that if someone is going to be buried around, then they're going to be affected with illness. So that we have to really fight this war also on this front, that we have to ensure that with mass awareness, we try to tackle this social stigma around this illness.